Penile Girth Enhancement Procedure and Methods. Male patients can also reach out to us. We have already started receiving some questions. Penile girth enhancement can be performed using different techniques. Some externally applied materials are used for this purpose. However, I personally prefer fat injection for thickening this area. This is because externally applied materials have a high risk of causing complications, either in the early or late stages. I am also against filler applications in this region. I have encountered many patients who experienced problems after getting penile fillers. Serious complications can arise. For example, the penis has a unique structure. The filler injected into this area may shift over time or cause significant issues even with a minor infection. A small pimple can lead to filler breakdown and discharge. Therefore, if the patient has sufficient fat tissue, fat injection is the best option for thickening the penile shaft. Why fat injection? It is a healthier and more natural method. Since it is autologous, taken from the patient's own body, there is no risk of allergic reaction. The risk of long-term complications is low. However, this procedure requires significant experience. The amount of fat injected, the patient's diet, and several other factors can affect the success of the procedure. In most cases, we harvest fat tissue from the pubic area, the hairy region above the penis. Slimming this area already improves the aesthetic appearance. The harvested fat is then injected into the penile shaft, leading to the desired result. How much fat should be injected? One of the most frequently asked questions by patients is, how much fat can be injected? However, the key is not to inject as much fat as possible, but to inject the right amount for optimal results. Injecting too much fat can lead to tissue loss and deformities. If the desired result is not achieved in the first session, a second or third session may be needed. However, this is a rare occurrence. To date, I have performed this procedure on thousands of patients, and only 10-15 of them required a second session. In very rare cases, some patients request an additional session for personal preference. The number of patients for whom I performed a third session is extremely low. However, I have seen cases where excessive fat was injected elsewhere, leading to serious complications. This is why the experience of the performing surgeon is crucial. This procedure only enhances penile girth. It is not a lengthening surgery. If the patient also has concerns about penile length, girth enhancement can be combined with a lengthening procedure. If you have any questions regarding this, I would be happy to answer them.